Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about that annoying dripping nose that starts with a cold, a sore throat, sneezing, or that feeling that mucus is constantly running down the back of your throat. And let's focus on vitamin C, not as magic, not as a cure, but as a practical tool that may support your immune system and may slightly reduce how long and how intensely some cold symptoms last. Start with this question. Why does your nose run in the first place? Look at the nose as a filter, a heater, a humidifier, and an immune checkpoint. When a respiratory virus enters the lining of your nose, your immune system does not sit quietly. It releases chemical signals. Blood vessels open up, fluid moves into the nasal tissue, mucus production increases. Tiny hair-like structures called cilia try to move mucus and trapped particles outward. That watery drip is not just an inconvenience. It is part of your body's attempt to flush, trap, and remove irritants and infectious particles. But here is the problem. That same defense system can become too intense. More swelling means more blockage. More mucus means more dripping. More postnasal drainage means throat irritation and coughing. Ask yourself, is the nose running because of a simple cold, allergies, sinus inflammation, cold air, spicy food, medication side effects, or something else? Why does that matter? Because vitamin C makes the most sense when the runny nose is part of a viral upper respiratory infection or when your diet is low in vitamin C. It is not the main treatment for every dripping nose. Now, how could vitamin C help? Vitamin C, also called ascorbic acid, is involved in several immune processes. Your immune cells use vitamin C during infection. White blood cells, especially neutrophils, accumulate vitamin C in high amounts. These cells move toward infection, attack microbes, and help clean up damaged tissue. Vitamin C also works as an antioxidant. During a cold, the immune response creates oxidative stress. That is part of inflammation. Vitamin C may help balance that response so the body can defend itself without creating as much collateral irritation. Look at the nasal lining. It is not just skin inside the nose, it is a living barrier. It needs collagen support, healthy blood vessels, and normal repair. Vitamin C is needed for collagen formation. If vitamin C intake is poor, barrier strength and healing can suffer. That does not mean taking massive amounts will build a shield in one day, but it does mean that having enough vitamin C is part of normal immune readiness. There is another point that matters for a runny nose. Some research suggests vitamin C may have a mild antihistamine effect at higher intakes. Histamine is one of the chemicals involved in sneezing, watery discharge, and nasal irritation, especially in allergic symptoms. Does that mean vitamin C replaces antihistamines for allergies? No, do not use it that way if your symptoms are significant. But it may be one small reason some people feel their cold symptoms are a little less intense when their vitamin C intake is adequate. Now let's be honest about the evidence. Large reviews of clinical trials have found that taking vitamin C regularly does not prevent most people from getting colds. So do not think, if I take vitamin C, I will not get sick. That is not what the better evidence shows for the average person. But regular vitamin C intake may slightly shorten the duration of colds. The effect is modest. In adults, the average reduction has been around less than a day for a typical cold. In children, some analyses found a somewhat larger proportional reduction. That is not dramatic, but when your nose is dripping, your sleep is poor, and you need to work, even a small difference may matter. Pay attention to the word regularly. The benefit appears stronger when vitamin C is already part of your routine before symptoms begin. Starting vitamin C only after the runny nose has already started has not shown consistent benefit in trials. Why? Because the immune response is already underway. The nasal lining is already inflamed. Viral replication may already be active. Vitamin C is not like turning off a faucet. Think of it more like supporting the plumbing and repair crew before the storm hits. So what should you actually do? Start with food. Do this before thinking about tablets. Build vitamin C into daily meals with citrus fruits, kiwi, strawberries, bell peppers, broccoli, Brussels sprouts, potatoes, tomatoes, and leafy greens. Why food first? Because food gives you vitamin C along with fiber, fluid, potassium, polyphenols, and other nutrients that support health more broadly. A glass of orange juice can provide vitamin C, but whole fruit often gives better fullness and less sugar load. For many adults, the recommended daily intake is about 75 to 90 milligrams per day, with higher needs for people who smoke. Smoking increases oxidative stress and lowers vitamin C levels, so smokers are often advised to get extra vitamin C. If your diet is poor, if you eat very few fruits and vegetables, or if you are under heavy physical stress, correcting that gap is important. If you choose a supplement, keep it reasonable. Many people use 200 to 500 milligrams daily during cold season or when they know their diet is not strong. Some use 1000 milligrams per day for a short period. Do not assume more is better. The adult upper limit is 2000 milligrams per day. Above that, side effects become more likely, especially diarrhea, abdominal cramps, nausea, and reflux. Also, your body absorbs vitamin C with limits. Very high doses mostly increase what you lose in urine. Ask yourself, am I taking this because I need it, or because I am trying to force my body to recover overnight? If it is the second one, slow down. Support the immune system. Do not try to overpower it. Now let's connect this directly to a runny nose from a cold. On day 1 or 2, the discharge is often watery. Sneezing may be strong. The throat may scratch. This is usually viral inflammation. Vitamin C will not dry the nose immediately. For immediate symptom relief, consider saline, spray or rinse, warm fluids, honey for cough if you are over 1 year old, rest, and proper hydration. If congestion is significant, some adults can use a short course of a nasal decongestant spray, but do not use it for more than 3 days unless a clinician tells you to, because rebound congestion can happen. For allergies, an antihistamine or nasal steroid may be more useful than vitamin C. So where does vitamin C fit? It fits as background immune support and possibly as a modest symptom-shortening strategy when used regularly. It may help your body handle the inflammatory workload. It may help maintain the nasal barrier. It may support immune cell activity. But it does not replace sleep, fluids, nutrition, hand hygiene, or medical evaluation when symptoms are severe. Look at timing. If you already take vitamin C daily through food or a modest supplement, continue it when you get a cold. If you do not take it and symptoms just started, you can still increase vitamin C through food and consider a moderate supplement, but set realistic expectations. Do not tell yourself, this will stop the runny nose today. A better goal is, I am supporting my immune system while my body clears this infection. Now pay attention to safety. If you have kidney disease, a history of kidney stones, iron overload conditions such as hemochromatosis, or you are on dialysis, talk to your clinician before using high-dose vitamin C. Vitamin C can increase iron absorption, and in some people that matters. High doses may increase oxalate in urine, which can matter for stone risk. If you are pregnant or breastfeeding, do not megadose. Stay near recommended intake unless your clinician advises otherwise. If you are receiving chemotherapy, radiation therapy, or complex cancer treatment, do not start antioxidant supplements without asking your oncology team. Why? Because some treatments rely partly on oxidative damage to cancer cells, and supplement interactions can be complicated. If you take cholesterol treatment with statin and niacin combinations, or if you are on multiple long-term medications, ask your pharmacist or doctor before high-dose supplements. Also remember that high-dose vitamin C can interfere with some lab tests and glucose readings in certain settings. Do not give adult supplement doses to children. Use age-appropriate products only if needed and prioritize foods. For babies, especially those under 3 months, fever needs medical attention. Do not try to manage an infant's fever and runny nose with supplements at home without guidance. Now, when should a runny nose make you seek medical care? Do this. Check the whole picture, not just the mucus. If you have trouble breathing, chest pain, blue lips, confusion, severe dehydration, stiff neck, or a high fever that is not improving, get urgent care. If symptoms last more than 10 days without improvement, worsen after initially improving, or come with significant facial pain, swelling around the eyes, severe headache, or thick discharge with fever, you may need evaluation for sinus infection or another condition. If one side of the nose drains foul-smelling fluid, especially in a child, think about a possible foreign body and get checked. If the drainage is clear and watery after head trauma, seek urgent evaluation. Also ask, is this really a cold? Allergies often cause itchy eyes, repeated sneezing, and clear watery drainage without fever. Cold air and exercise can trigger non-allergic rhinitis. Some blood pressure medicines and overuse of nasal sprays can worsen nasal symptoms. Pregnancy can cause nasal congestion. A deviated septum, nasal polyps, or chronic sinus inflammation can keep symptoms going. Vitamin C is not the answer to all of these. Now let's make a simple plan. Start with fluids. Your mucus becomes more irritating when you are dry. Use saline spray or a gentle saline rinse if you tolerate it. Wash your hands. Sleep more than you think you need. Eat vitamin C rich foods daily. If using a supplement, choose a modest dose and avoid stacking multiple products that all contain vitamin C. Read labels. Many cold powders, immune gummies, multivitamins, and fizzy drinks already include it. Pay attention to your stomach. If vitamin C gives you diarrhea or cramps, lower the dose or stop. Dividing the dose can be easier than taking a large amount at once. Take it with food if your stomach is sensitive. Do not keep taking something that makes you feel worse just because it sounds healthy. And think about prevention in a broader way. Why do some colds hit harder? Sleep debt, stress, poor nutrition, smoking, heavy alcohol use, uncontrolled diabetes, and chronic lung disease can all affect immune response. Vitamin C is one piece. It is not the whole system. Build the system. So, is vitamin C beneficial for a runny nose? The most accurate answer is this. It may help indirectly when the runny nose is part of a common cold, especially if taken regularly as part of adequate nutrition. It supports immune cell function, antioxidant balance, and tissue repair. It may slightly reduce cold duration and symptom intensity for some people, but it does not instantly dry the nose. It does not prevent every cold, and it should not delay medical care when warning signs appear. Look at your symptoms. Ask why your nose is running. Support your body with hydration, rest, saline care, and vitamin C from food first. Use supplements thoughtfully, not aggressively. And if symptoms are severe, persistent, one-sided, linked with breathing problems, or happening in someone medically vulnerable, get professional evaluation. Take care of yourself, take care of the people around you, and keep learning how the body works. I'll see you in the next topic.